Just in the literally in the 10 years, or
in the 10 years,
since he can remember even. Let's say it's just in the 6 or 7 years since
he was a toddler
11,
when we moved here. So it's amazing. Obviously, it's still not as big as the beach area, but we are growing out the Loris way as well, which is why we want to maintain our 105 beds at Loris, as well as have the new addition here at Seacoast for the 50 beds.
We got about 10 minutes, Tim. Let's spend a little time focusing on, of course, tomorrow we'll be with Tammy Eaves. You mentioned the executive director has been with you a few months here, and of course you'll be expanding the Loris Seacoast Healthcare Foundation dramatically as you all move forward. But give viewers a sense, if you can kind of give us a little virtual tour. Sure. I know it's particularly easy. We're video. Yeah. It's sight, sound, and motion. It'd be great to have some video to go along with it. But for viewers who may not have visited your facility there in Loris, and then if we have enough time to highlight this, but just if they were pulling up for the first time there in your facility in Loris.
Well, the Loris Community Hospital is a 4-story facility, and we have on the first floor we have an ICU, an ER, and all the OR areas, and all the ancillary areas like lab and X-ray. Some of the administrative offices and the dietary areas on first. On the second floor, we have a unit that's actually a unit where we can monitor patients, post-surgical patients, telemetry monitoring. On the third floor is a general medical floor and also our progressive care unit, which is sort of a step-down unit between the floors and ICU.
Okay.
And on the fourth floor is our women's floor. Our women's floor where we have labor and delivery and recovery and the nursery. So, and across the street from the hospital is the Center for Health and Fitness on Casey Street. And a block down the street on Stevens Street is the Loris Extended Care Center. So we have all that within a block of operations right there in downtown Loris.
Boy, Tim, for you, are you spending a lot of time there in Loris, or you are buzzing up and down Highway 9?
Well, I spend a lot of time in Loris, but I also spend quite a bit of time at Seacoast Medical Center, too.
Right here.
And right here in Little River. And this facility was, I sort of was very involved with the initial planning of this facility, very involved with the design and the plan. And I brought Arnold Green on board as our systems chief operating officer, and he's in charge of this facility on a day-to-day basis. But I'm very much involved with our system activities and have a lot of things here at Seacoast.
When you were getting your undergraduate degree or your master's degree, had you contemplated that you would ever be in a position like this, or would be working towards something like this?
I'll be honest. I initially thought I was going to go to medical school, so I have a degree in biology undergrad. And about midway through my junior year, I decided that I would have a little more business approach to what I was doing. So I kind of combined my interest in healthcare and business and came up with hospital administration. Went to see a few hospital administrators, asked them what they did.
Really?
And got real interested. And then I pursued a master's degree and received a master's degree in hospital administration. And then, like I said, worked 15 years for a company out of the state of South Carolina. And most of my career was in Kentucky prior to coming back home to South Carolina. And then have been with Loris Healthcare now for 10 years. So.
Was that also at a community institution, a not-for-profit institution?
It's actually out of state. Was all for profit. I worked for the Humana.
So you've seen both sides.
I've seen both sides.
Humana's huge. Yeah.
Sure. I worked for the Humana Corporation. I was recruited by them out of graduate school at the University of South Carolina.
Right. So you have seen both sides.
Absolutely.
And I'd like to wrap the interview with that. We've got a few minutes, but as you use the word community in the middle name there, Loris Community Hospital, even though the healthcare systems had to expand and you still have the community name in there, right there on facility. And that is so important to think about.
Absolutely.
When you think about the needs both of the community being dependent and responsive to a local board, a community board, and then to think about the community. You're probably seeing an influx, some coming from Brunswick, some from parts of Columbus County.
Absolutely.
That cross the line to come on over to see y'all.
Over 25% of our patients come from North Carolina.
Is that right?
Absolutely.
That large?
That large.
Wow.
Yeah, because see, the border's only 4 or 5 miles from Seacoast, and the border's only 6 or 7 miles from Loris. So it's very about 25% of our business comes from the Columbus and Brunswick County.
You know, as you think about, you talked a little bit about the expansion there in Loris. What will the expansion do there in Loris? And then maybe we can talk. We've got a few minutes to talk about the expansion here.
The expansion in Loris is an $18 million addition to the campus there. And that $18 million will include a new emergency department, a new ICU, a new pharmacy, and it will be a new 2-story structure that's be adjacent to the hospital but yet connected. The addition here is about a $30 million addition, all 50 new beds, that we're going to be placing out back of the Seacoast facility.
Right behind
Right
us
behind
here.
this facility.
Okay.
It'll be a two-story addition to our campus here. And it will be 32 medical surgical beds and 18 beds that will be either progressive care or ICU, intensive care beds. So.
And then the other 10, obviously. Right.
Yes.
Right.
Right.
Oh, you said 32 and 18.
32,
excuse me.
yeah.
I had written down a breakdown of 8.
Of the 8,
right.
8 in one unit and 10 in another unit. That's correct.
That's tremendous.
That's right.
Is tremendous. You know, and of course, as you think about the real needs and to see the expansion in this area, as you travel up and down Highway 9, do you ever in your mind, as a visionary, begin thinking about, could there be something between these two even?
Well, you know, I think the area, the Highway 9 corridor is really growing.
Right.
And I think with maintaining the operations in Loris and building the new operations here, I think hopefully we'll have enough beds to take care of the needs of the citizens of this corridor for quite a bit of time to come in the future. So.
What do you expect the foundation will be able to do to advance the goals for the Loris healthcare systems, the Loris Seacoast Healthcare Foundation? What was the expectation when you all began the...
Well, actually, we are very excited about the newest addition, the Loris Seacoast Healthcare Foundation. And with Frank Bullino's leadership as our chairman, and with Tammy Eves as our executive director, we're excited about the prospects of raising funds to help us with these projects, both at Loris and both at Seacoast. So we're excited about that. The important thing to remember is that the hospital and the healthcare system is funding the office of the foundation. All money raised by the foundation go directly to our projects, whether it's the beds at Seacoast or whether it's the ER/ICU expansion at Loris Community Hospital. And then once we get that, the foundation will stay in place because there will be funding mechanisms for opportunities for further enhancement of services at Loris Healthcare System in the future.
You say all, you mean like 100%?
100%.
All those expenses are covered by Loris Healthcare System, so that truly, if a viewer right now was watching and they picked up the phone and dialed the 390-2815, was it 2815?
8215.
Thank you. I was a couple numbers off. 8215. If they pick up the phone and dial that number,
that's right,
they're going to know that if they make a donation, those dollars are going all into
absolutely.
The foundation's
And you know, so many people today with philanthropic dollars, they give to their religious affiliations, they give to their educational foundations. Healthcare is very much a part of what we do in life and what we need in life. And so it's very important to remember healthcare when giving is your choice.
You know, a lot of folks may sit back and think, why, in a facility that's generating 150, 185 million in annual revenue, that has a heck of a lot of employees, why do they need money for a foundation? They can do it all on their own. What are some of those real needs, Tim? I mean, why do you need money for a foundation?
Well, I'll be honest with you. There's a lot of changes in reimbursement for the services that we deliver.
Right.
Governmental reimbursement has declined. Managed care contracts has actually shrunk the dollars that the healthcare system receives for the services we perform. And the rising number of uninsured patients and the people that can't pay their co-pays and deductible places a burden on the healthcare system, actually, especially a public community healthcare system. So we're in need of additional dollars to meet our strategic objectives, like the beds at Seacoast and like the new addition at Loris Community.
So these dollars will really be used and reinvested right back here?
Reinvested right here in the communities that we live in to take care of the citizens that live in this area.
As you think, Tim, for yourself, you know, just trying to imagine, obviously we can think back just a few days, a typical day for you. Obviously, you said much of your time right there in Loris.
Sure.
But as you think through, are you an early riser? Are you late to bed? What's a typical day for you?
I'm at the hospital every morning around before 7 o'clock.
Is that right?
And I make rounds and see the employees in the hospital and talk with the physicians there. And I have meetings throughout the day, and I have a lot of night meetings too.
You do?
Yeah. In fact, we spent some time last week with an OBGYN candidate who's looking for a practice opportunity, as well as an orthopedic candidate who was looking for a practice opportunity. So we have a great need for additional physicians in our area. So we're having new recruits coming in looking at practice opportunities so we can meet the needs of this growing community.
I think you mentioned before we started filming last Tuesday you were in Durham visiting Duke, and to
Absolutely.
think about, you mentioned the Duke Endowment and its support of helping
Absolutely.
to expand early on.
Duke Endowment has been very generous to healthcare systems in North and South Carolina, not-for-profit healthcare systems.
Right.
And we've benefited from the Duke Endowment grants for many projects here. And we're also going to be talking with them about helping to fund some of these construction projects once they're underway as well.
Great. your biggest hope, and of course being one of the visionaries that helped plan out the Laura Seacoast Healthcare Foundation, your biggest hope, let's say 5, even 10 years from now, of what you plan where the board should be? What's your biggest desire here, Tim?
Well, I'll tell you, I think Conway Medical Center does a great job with their facility and their foundation. We obviously are very interested in making sure our facilities stay current and stay abreast with the latest technology. We want the Healthcare Systems Foundation to be extremely successful. We want to raise the money necessary for construction projects, equipment projects for the future, and we feel like with the leadership that we've got on board with our foundation board that we can make that happen.
Great words. Tim, thanks so much for being with us this morning.
Appreciate it.
Absolutely. Stay tuned to more Carolina People with the Loris Healthcare System President and Chief Executive Officer Tim Browne coming up next. Golly, what a day like today, January 21st today, we're celebrating dreams. You know, we think about that, not to take anything away from Dr. King's dreams and, of course, that goal of bringing races together. You think back dreams 60 years ago as these men are sitting around at a Civitan meeting in the mid-1940s, and they're dreaming about how can we make a difference in our community? How can we touch healthcare needs of folks like us, folks sitting around this room as well as all over this community? We can make a difference. And you heard Tim talk about it in 1946 as the legislature passed that and got the ball rolling. And then 1950 as those 23 beds opened up for service right there in the Loris community. That's a key word. Just like the same words that Tim talked about of 100% of any dollar that you think about donating to the Laura Seacoast Healthcare Foundation will be reinvested right back into this community, into the Little River, North Myrtle Beach community, into the Loris community, into this entire community. Hearing him talk about 25% of their patients coming in are coming and crossing the line. The needs are over there in Brunswick and Columbus counties, and they have to cross the line, just like folks back prior to 1950 having to cross into Marion County to go to Mullins Hospital or having to travel down to Conway to get served. Right now they can do it on their own, sitting there in Loris, coming over here to Little River, they can be served. The dreams have been fed, and they've been fed very well. Celebrate the dream. Go online to lorishealth.org, lorishealth.org, or pick up the phone, 843-390-8215. Give Tammy Eves a call and learn more about the Laura Seacoast Healthcare Foundation.